Depression is a disorder that is the hallmark of which is either sad or blue mood most of the day, nearly every day for at least a 2-week period, although it can last certainly much longer than that. And for some people, that the primary symptom, rather than blue mood, is lack of interest in usual activities. And for other people, they have a combination of both blue mood and lack of interest. This depression can occur in response to a life event, a major change in life, such as a divorce, a loss of someone close to you, or other kinds of adverse situations. Or it can come in out of the blue. People can experience that out of the blue without any other stressor that may go with it. In addition to sad or depressed mood or lack of interest, people can also experience changes in appetite, increased appetite or decreased appetite, changes in sleep, where people may sleep much more or much less than their usual selves, lack of energy or fatigue, changes in concentration, not being able to remember things as well, not following conversations, not being able to read as well as one usually would. And that may be combined in some cases with thoughts of death or feeling that you might be better off dead. When people experience depression, and this is a prolonged period, that's what we think of as major depressive disorder, it interferes with activities of day-to-day living. So it may interfere with social activities, it may be more difficult to get to work or to perform at work or to be able to be engaged in other aspects of life that you would ordinarily enjoy or participate in. So for patients who have both diabetes and depression may take many forms. One of those forms may be that it's much more difficult to take care of diabetes in the way that you ordinarily would take care of it. That might be having difficulty remembering to take medication or refilling medications as you normally would. That may be lack of interest or motivation to follow diet or to engage in physical activity as it's prescribed by your doctor. And so it can be much more difficult to engage or testing blood sugars. And so it's much more difficult to engage in those day-to-day routines that are part of managing diabetes and part of day-to-day life.